All right, so we're going to look at Chapter 9, Question 9. And it was chest pain.
Yeah, chest pain, probably angina and thoracic.
Okay, I'm spacing because my mind just went completely blank. Okay, pain, chest. Okay, so for just regular chest pain, I'm coming up with 786.50.
Yeah, that's what I'm looking for.
Okay, but the correct answer is saying that's angina.
786.50 for chest pain doesn't matter.
So it's saying it's 413.9. That's got to be the same issue. The 413.9. Okay. Like I said, I will give credit for either one.
What do you recommend the critical coder do when they're faced with something saying probably?
It depends. If you're in a hospital and you're doing coding, then you're going to code probably. That's what the guidelines tell you to do.
Okay.
If you're in like this type of office, you don't.
Outpatient, then you don't.
Right.
Okay.
Yeah. Oh, excuse me. Trying to think. Unless the book says otherwise, assume it's outpatient. And then if you find something that you don't expect, because hey, I coded this according to outpatient, I don't want you to tell me. Okay? And those who are watching the video that tell me get credit. Those who don't, don't. So that's just going to be the way that it is. Except for these last few problems, because we really didn't know that. Amy, too. Any other questions? Any general concepts that we need to go over?
How do you know what's easily communicable as an infectious disease?
Anything viral?
Okay.
Yeah, other than that, between viral, bacterial, even viral, if it's an airborne virus, that's the most easy. Other than that, I don't have anything specific. Why do you ask out of curiosity?
So now you can't find it, but that's what it talks about.
It was part of the coding rules or guidelines, I believe, that you would determine whether it was
Yeah.
contagious for choosing.
Right,
code.
conditions that are not considered to be easily transmissible or communicable are classified in the appropriate body system chapter. So I guess that's my, and then you have the additional code, then you add the code, so.
So here's what I say to that, Don't worry about it,
Okay.
because you're gonna be looking it up in the alphabetical index first, so it doesn't matter. You'll find it, regardless of what chapter it's in. And then, as far as using additional codes or whatnot, you'll find that either in the instructions in the alphabetical index, the instructions in the tabular index, or in the coding guidelines.
Like the one that I didn't read.
That one,
Yeah,
yeah.
that one. Done.
See, that was
Yeah.
easy.
Okay.
And then just especially for you, because this is the second time it's come up, is read the notes before.
Right. Yeah, no, I can see that's my problem.
Yeah, because the code is part of a group.
Right.
So think of it that way. You need to know what the rules are for the group, not just the individual code.
Right.
Any other questions?
There was a problem about the, in the 7.2, kick a trickle contracture of left hand in the burn. Did we deal with that before? I don't know.
I
I was a
think
bit
so.
confused by it, because the way that the correct answer didn't seem to take contracture into,
Consideration.
so it was chapter 6, in the tester, the homework, online homework, it was 6.7.2. I don't know where that is in the book, though.
61. Yeah, it's 61.
Oh, page 61, okay, yeah, that one, yeah. Pick a trickle contracture.
Mary, can I have
of
a right
left
book so I
hand.
can see it? Oh.
Your response was 709.2 plus 906.6, but I came up with 718.44 plus the E code for a burn.
Remember, we're not coding E codes.
Oh, why not?
Because quite frankly, we haven't gone over them yet.
Oh,
Yeah, that's what should be, it said if late effect is due to injury, like there's a one about a fracture, and it says to put a late effect E code, I put one in and it was wrong.
So email me which one that was, and I'll correct it. The reason, so there's a couple reasons that I don't go into E codes, okay? The number 2 reason is because I'm pretty sure I'm right about this, we haven't gone over it yet, okay? And there's a very specific way of going about finding E codes. They have their own index, okay? So that's the number 2 reason. The number 1 reason is, quite frankly, at least in my world, and from what I see in the hospital world, they're not used. A couple times physicians have tried to use them as, like, if somebody falls or something, but that's the only code they give me, so I go into the note and I'm saying, well, no, they got a contusion, they, have a contusion on the left arm, or whatever the codes are, that the symptoms are that they're presenting with. And then I end up never using E code. The way that came about was when I first started doing auditing, I audited our occupational health clinic, and I came up with E codes all over the place. Now, occupational health, that's where you get E codes. I mean, they should be rich and abundant, right? They kind of looked at me with a funny look, like I said, we don't even know what E codes are. We've never used them, and we've never not gotten paid for them. So why do we need to put them in? Good point. That may change with ICD-10. I don't know. I'm just starting my ICD-10 education. Actually, it won't start until September. And that may change, because that's a whole new world. And the claim form is different as well. There's another claim form coming out right now. We're doing the 1500. Has room for 4 diagnosis codes, and that's it. No more, no, well, less, but no more for sure. The 5010 that's coming out has room for 24 diagnosis codes. So it changes the ballgame considerably. So in those cases, those type of emergency codes that might come into effect. So let's go through this.
So I'll talk you through this here. You are saying that the correct answer is 709.2 plus 906.9. Now, 709.2 is scar condition and fibrosis of skin. Now, thick a trickle, I believe, is an adjective for scarring. And the 906.6 is late effect of burn. But my answer is 718.44, which is contracture of the joint of the hand. And
where do you get that the joint was involved?
Well, I interpreted this to mean that the contracture was what was really important, since kick and trickle is an adjective, so,
But contracture of what?
of a joint.
But there's
Of
no
the
joint
hand.
mentioned in there. You have other muscles in your hand besides the joint.
Well, isn't a contracture mean, what does a contracture mean?
So contracture means that the muscle is, usually a muscle is contracting.
Right.
It's getting shorter.
Well, when I looked up contracture, I guess I found contracture of joint. Maybe I should look up contracture again.
What did you say was the 906 code?
906.6 is the late effect of a burn.
Okay, I think it's the 906.9.
She did, but I knew what she meant.
Because I was like,
Yeah, it's 906.6. So contracture, it just said contracture of hand.
Okay, so if I look under contraction,
There's nothing specifically about hands.
cicatricial, it says C-cicatrix. I'm assuming I'm pronouncing it correctly.
Cicatrix.
So now if I look under cicatrix, cicatrix, my Latin is rusty. Okay, so if I look up cicatrix, the default code, if I can't find anything more specific, is 709.2. And as I'm going through this, oral bladder, genital, eyelid, knee, I don't see anything for hand or limb or extremity. The only thing that comes close is wrist, constricting annular, but it's the same code, 709.2.
Yeah, the only thing that was under contracture, the place where hand is under joint.
Right, but see, here's the thing is though, if you're looking under contraction, the next place you should look is not of left hand, it's the cicatricial. So, when you look under that, it says, see, the cicatrix.
Okay.
So you have to go there.
Okay.
And that's how we get that 709.2 code.
Okay.
Since we found something more specific, that's where we need to go. And then the late effect of the burn is you just look under late.
For the contracture of the hip following a partial hip replacement, would you code that they had a hip replacement?
Depends on how much room I have on the claim form. If that's the only reason that if they were here, yeah, probably.
We did the contracture of the hip and then because of the hip replacement?
If it was in the documentation, absolutely. a specific problem?
Exercise 6X.
Oh, number 4?
Yeah.
Traction joint, hip, 7/18/45. Following partial hip replacement. So then that would be a late effect. Actually, for late effect, we don't do. There might not be a code for the hip replacement. And that's more just because what I know about V codes.
I wouldn't be.
Where is that hip replacement one? Where do I find that?
Well, it's, for a hip replacement?
Yeah, here we are, number 4.
Yeah, that's where the code is. So I'm looking under late effect of. Well, actually, no, I don't think that would be it, because it would actually be a complication of no late effect. And they do actually have a late effect for complications of surgical and medical care, conditions classifiable in 996 to 999. But since we're using a 700 code, then it doesn't apply.
Okay. We just have the 700 code then?
Yeah.
Okay.
I put a V code down there, V4364.
Yeah, that's what I did too.
The problem with using a V code is the V code tells you that they had one, but it doesn't link it to the hip contracture. If I saw that as an auditor on a claim, what I would think I was being communicated is that this patient had a hip replacement, and I think it's correlated to their current condition of hip contracture. Where what we're trying to communicate is something stronger than that of, no, this hip contracture is due to a hip replacement. Not that we think it's correlated, we know. But there's no code for that. Now in ICD-10, I'll bet you there is.
Wait a minute, on 996 point, I put something down there, 996.9, complication, 996.9, complication of reattached extremity or body part.
It's not reattached. It's a replacement.
Oh.
So reattach says it's fallen off and you put the original back on. And you hear about these horror stories in the emergency room where they cut off their finger, they come back on and they sew it on. That's, if there was a complication from that, that's the code you would use.
How about, 997,
Which is what?
complications affecting specific body parts not elsewhere specified.
Well, the problem is that we've already got the hip contracture.
Oh.
And when we look at the late effect code, it says it's for conditions classifiable to a certain range. And the code that we're using is outside that range. Let me double check.
So a partial hip replacement is not the same as an implanted device or graft?
No, definitely not.
Okay.
An implantment or a graft would be like a stent, cardiac stent, something that's surgically implanted inside somebody. I'm not seeing anything that would even be close.
It's not a prosthetic joint implant, is it?
No, it's not an implant. Oh. And actually, it doesn't even say due to. It just says follow. Yeah, yeah. Thank you, madam. Okay, any other questions? Administrative questions?
I was wondering how you got to brain damage.
For which question?
For brain damage following cerebral abscess. It was kind of hard getting to that.
Okay, so.
Oh, by the way, the hip, I got it, you know, okay, you didn't need the decode, okay, never mind.
So it just says brain damage?
Yes.
Are we looking at a child? Doesn't
No,
say.
it
So we're just
doesn't say
assuming that it's-
specify,
Okay, so I get 348.9 for brain damage.
I wonder how you got there, though.
Under damage, comma, brain.
Oh. I see. Okay. I was wondering about this, malunion of, oh, wait a,
Would you code the cerebral abscess or not, since it's following?
It's I would try to find one, and if I didn't find something that was real concrete, then I wouldn't. Does that make sense?
Yeah.
So the one with the hip replacement is really nebulous and ambiguous, and I don't feel comfortable with anything that's really concrete. But usually for brain conditions, there's usually something that's really good, just for kicks. Late effect of, what was it? Abscess?
Cerebral abscess.
Cerebral abscess. Got an intracranial abscess. That would count. See category 326. Jeez, I want you to know the whole category. Wow. Yeah, intracranial abscess, cerebral abscess would be 324.0. that's what it's conditioned, or that's what we could put it under.
324.0? That's what I had, but you said the following answer is 348.9.
No, actually, it'd be 326.
Okay,
So
well,
brain damage, it would be brain damage due to, it would be, I'm pretty sure it was whatever the brain damage code was, and then the late effect.
Looks like the quiz answer is wrong then.
So it'd be 348.9.
Quiz answer was 348.9.
And then followed by 326.
Right.
But,
That's what I just said.
right,
What did the quiz say?
I know, but I have a question.
Okay.
Because then when I read the note, this category is to be used to mitigate conditions whose primary classification is blah, 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 and I didn't see 348.9 in there.
No, it's, no, okay. I think what that's saying there is that it's actually, it's saying a late effect of all the things between 320 and 325.
Okay.
So it's kind of clarifying, because you notice 326 is one code.
Right.
So now people are going to say, okay, well, what counts as intracranial abscess or pyogenic infection? Especially pyogenic infection, because that's pretty broad.
Mhm.
And they're saying in order to find out if 326 applies, you should be able to code that to 320 to 325. And we just did. We did it to 324.0.
Right, okay, yeah.
Does that make sense? It's
Yeah,
kind of
yeah,
worded
okay.
kind of funky.
Yeah, okay. I see.
Clear as mud?
I'll say that even if it isn't, because I'm not gonna screw up. I had a question on that same, what, 6.7, the bilateral neural deafness resulting from childhood measles.
Oh, yeah, where's that? Did we go over that one? Well, it was very confusing because I came up with this more specific thing than measles, and so I was a little confused.
So, okay, hold on a second. Let's just take it one step at a time. So it's bilateral neural deafness.
And that code was 389.12.
Well, hold on a second. I always take it through the process, okay? Because usually, if you get the wrong answer, it's in the process, not in the code. So let's always go through the process. Okay, so deafness, they said it was neurodeafness?
Mhm.
Neural, with conductive hearing loss. Read me the question again, just so I know.
Bilateral neural deafness resulting from childhood measles 10 years ago.
Okay, so the bilateral code's 38922. That's originally what I get. Is that what you had said, Amy?
389.12.
1-2 or 2-2?
12. 389.12.
Because I got 2-2.
It's mixed hearing loss, though.
This
It's
is-
between sensorineural and conductive.
What was that? Bilateral neural deafness. 389.12 is bilateral neural hearing loss.
Neural hearing
Oh, no,
loss.
sorry. I misread it. Never mind. It's 389.12.
Yeah, neural hearing loss bilateral.
Okay, so then that's one thing. Now, we're just looking at due to measles 10 years ago.
Yes.
That 10 years ago means you're not going to look under measles. Where are you going to look?
Right.
You're going to look under late. Because it's a late effect of measles.
And then we've got infectious diseases under late effect. Conditions classifiable to 001-136, NEC 139.8.
Just a second, let me catch up to.
So the quiz answer was 139.8.
What's 1 through what, I'm sorry?
9.8.
Right, and so when it says in the alphabetical index, conditions classifiable to 001 to 136, what that's telling you is it's a late effect of measles. So if the measles code falls in that range, then you use the 139.8.
So if measles falls in that range, we use 139.8.
Because 13.98, 139.8, if you read it, it's a late effect of other infectious and parasitic diseases.
What does that code use?
So if I look up under measles, I'm willing to bet you that it falls.
But it doesn't, it's 55.
Yeah, 55.7 is what I got. But that 55,
055.7?
yeah, that's within that range though.
Yeah, that's within the range.
Okay.
Oh, okay,
What was the range?
001
right.
to 136. Be careful when you're saying 55. The only reason is because the
Yeah.
volume 3 is procedure codes, and it has 2 digits,
Right,
a period, and then X number of digits. So you could, outpatient people, I would understand what you're saying, but if you're talking to somebody from a hospital,
yeah.
yeah. Does that make sense?
Yeah, that makes perfect sense now. Hindsight is.
Hindsight is 20/20. Well, given that most of the population wears glasses or contacts, you might say it's like 2010.
Oh, I see.
Yeah, so that diseases, that when it's telling you that the diseases are classifiable, it's not talking about the late effect. It's talking about the disease itself.
It actually does have a late effects, infectious diseases, conditions classifiable under late effect.
Right, but when it says that condition's classifiable too, it's telling you that you look at the underlying organism. It always makes perfect sense when we sit down and talk about it, which is why we sit down and talk about it.
I was a little confused. Wait a minute. Sorry.
Excuse me.
I'm a little confused about this one, flaccid hemiplegia due to old cerebrovascular accident. It seems like the answer, 538.20, doesn't have anything about the cerebrovascular accident in it.
What code was it?
438.20. Hemiplegia affecting unspecified site,
438.
.20.
Okay, but see, you're only reading part of the description. Remember that this code is part of a group. So to get the full description, you have to go back up to the 3-digit code.
Oh.
So if you go back up to 438, it says late effects of cerebral vascular disease. 438.2, hemiplegia, hemiparesis, hemiplegia affecting unspecified site.
Okay.
And that's where it says
So you only need one code for that.
you only need one code for
I read that.
that. Practice makes perfect. It gets easier with electronic systems because they have the codes right there for you and the description, or at least enough of the description to give you that. Doing it by hand is a lot harder because you can transpose digits. You think you remember the 5th digit, but you're off. My favorite is transcribing from something that's handwritten. So it looks like a 9, but it's really a 4 because somebody writes their 9s or their 4s in that special little way. So, yeah. Hopefully this will be as hard as it gets, as far as the numbers go. Okay, so the chapter 10 is this week, and that's the infectious diseases. We've kind of beat around some questions with that. What's chapter 11 and 12?
Diabetes, mellitus, and mental disorders.
Yeah, mental disorders is actually pretty easy. For some reason, I think people get that, and I think a big reason too is there's usually no underlying causes, if I recall. So it's a little bit more straightforward. Diabetes is its own special animal. The best advice I can give you on that is follow the directions. Not in the book, but in the code.
Okay.
All right? And probably go over the coding guidelines in there. Because they'll have a section on diabetes, because you've got 2 types of diabetes. You've got type 1 and type 2. You can also have 2 statuses, controlled, uncontrolled. And then you can have all these complications. So, and with the rise of diabetes in America, it's becoming a code that I use quite a bit. Or a family of codes, I should say.
I think remember while you were doing it, there were some coding questions in reimbursement or data sense or whatever about diabetes and controlled, uncontrolled, and insulin. Is there a connection between controlled and uncontrolled and insulin, or am I just?
No, insulin dependent is type 1, type 2. That's what they're trying to get at.
Okay.
I can't remember which is which.
I think it's type 1.
Is insulin dependent? That would make
I
sense.
think so.
So that's what they're getting at. And then controlled and controls. Usually determined by the blood sugars.
Okay.
Measured by hemoglobin A1C test. If it's over 7, it's considered uncontrolled. 7 and under is considered controlled. I think that's right.
Okay. Okay.
And that type of stuff is important to know just because sometimes, very, very rarely, but sometimes you'll have a physician who won't document whether it's controlled or uncontrolled, but you have the lab test.
Right.
And clear-cut guidelines like that as to what's controlled, uncontrolled, that's something to know. You won't need to know that for the test, that's just professional advice. Any other questions?
I have just a general, about mental disorders, we'll probably find this out when we read it, but, what is the connection or disconnection between ICD and the DSM?
As far as I know, there is no connection.
Okay.
There are 2 different classifications. ICD-9 is used I have no idea how the DSM is used. To my knowledge, ICD-9 is used on the claim forms. The DSM, I'm not sure what they use. My gut feel is it's more for classification in the medical, not in the financial.
Yeah, no, I think you're right. Now that I think about it, yeah, I think you're right, it is. I think that it's it gave standards.
Yeah.
It's basically guidelines for diagnosing
Right.
versus.
The only reason I say that is a couple of reasons. One, we have a counselor here on site, but HIPAA, the law is very clear. You use ICD-9 for your diagnosis codes.
Yeah, no, I did a little bit of coding actually for a mental health counselor.
Okay.
And I mean, I didn't figure out any codes because she had, depression, anxiety, and that's the only two
Or
codes.
panic attack, that's another one.
Yeah, there were only like 2 or 3 that we
Yeah.
used, so.
That's the nice thing about a specialty is, well, depends on the specialty, is like cardiology, you're gonna be pretty much that chapter. But the hard part with primary care is that I'm in those chapters, So I get a broad range.
I was concerned about the number 62.2, chondrocalcinosis of shoulder region due to pyrophosphate. You have disorder of calcium metabolism and then chondrocalcinosis due to pyrophosphate crystals, shoulder.
Excuse me.
And I just wondered how you managed to come up with those two.
I copied the answer out of the book.
Okay.
It was costochondral calcinosis,
Chondrocalcinosis.
chondrocalcinosis. Calcinosis. So, I can never remember, is chondro CHO or is it C?
CHONDROCALCINOS.
Karma, chondromalacia, calcinosis. Okay, so I see, okay, read the problem to me again.
Chondrocalcinosis of shoulder region due to calcium pyrophosphate.
Okay, so I have 2 codes right off the bat for that. 275.49 and 712.2 something. There's a 5th digit there. Okay, then that would be it. And it has to be coded that way. Remember I said there's directions in the alpha index, directions in the tabular index, directions in the coding guidelines? This one's right here in the alpha index. It gives me what codes to use. Now I would still look them up, but I'm pretty confident that's where the codes came from.
I have one. What does, it was in one of the codes that, for chapter 10, but I don't remember which one it was, maybe it was down. This one, it has in parentheses a number M9100/3, which is
Oh.
the choriocarcinoma. What does
Yeah.
that mean?
So, we'll get into this when we get into neoplasms, which I don't think we get into this course, but in the next course we do, for sure. And there's a classification of malignant tumors. And I can't remember what the name of it is, but they start with an M. Actually, here, unless you're book, it's this other book. Because I think they actually go into that. Those M codes are not used for billing. What they're used for is oncology.
Okay.
maybe we will get into. Nope, maybe not. Oh, I'm looking at the table of contents for the IC notebook, not for the. It's Friday. Yeah, it definitely won't be until, because it's chapter 25.
Okay.
But, in the interest of knowledge, and just because it's driving me nuts that I can't remember what they're called. 25 neoplasms. Morphology. The morphology codes. And that's something specific to oncology, tumor registries, that sort of thing. Anything else? My brain is ready to call it a night, folks. Alright, so next time, June 1st.
Yep.
And then I'll look into these specifically. I'll fix that 011.4 to 011.04. There's 3 problems. The 10.115 I want to research. The 9.115 and the 9.19. I'm pretty sure those are just between inpatient and outpatient. And then I'll see if there's a way that we can do retro reviews on Key. I think there might be a way to do it, but I have to kind of tweak some of the settings in order to do it right. Right?
I hope I can make it on time, I'll try.
Okay. Yeah, I hope you can too.